Hi, I'm Todd, and this is my sixth day of post-op following ACDF surgery, 4 levels, C3 through C6. So that basically covers almost the entire cervical region below the brain, the spinal cord. I had 4 discs replaced there, and some cleaning out of the bone spur and arthritis and all those other things that were causing a lot of my problems with pain and mobility in general. So, yeah, the good news is I'm getting to feel already back to myself. I have to wear this collar uh, pretty much 24 hours a day for the next month or so until my next follow-up appointment with the neurosurgeon. Surgery went really well. It was about 6 hours, I'm told, which is by far the longest surgery I've ever had to endure. But I've never had anything anywhere close to this type of magnitude in terms of the issues at hand and also uh, the possible benefits that I might get um, out of having the surgery and going through recovery. It's a fusion surgery, which means, of course, that the discs that are put in there, which are artificial in this case, have to fuse with the rest of the uh, existing bone, and that could take up to 12 months. But the good news on that is that it doesn't necessarily mean that I have to wait 12 months to get back to physical activities I was doing before, which at times could be pretty strenuous. Still consider myself adventuresome, and I will go and still do some things that I probably shouldn't, but they're a little bit too, might be considered too uh, excessive for a 60-year-old guy, but I don't feel like I'm 60 years old, even before this operation. So, anyway, that's that, and that's kind of how everything went. There were no complications during the surgery. uh, Standard pre-op, getting IV'd up, getting my the area cleaned, and just getting to the surgery early enough because they start these things so early in the morning now. The surgery itself actually started at 7 a.m., but I was wheeled into pre-op about 5 a.m. So I had to be at the hospital by about 4. And anyway, I experienced some transit anxiety getting there, but that's wasn't too bad in the long run, and I made it there, and I was fine. Uh, what else can I tell you? I After the surgery, I was moved into pre-op or post-op recovery, and kind of closely watched there for a few hours before uh, being sent to my room at the hospital, which was a very nice room I was in for 3 days, and just getting a lot of rest, getting used to eating again, um, doing a little bit of physical therapy in terms of walking around, and that was about it. With the physical therapist there, not too much of that, um, because my home situation could be somewhat different. And actually, as far as right now goes, I'm not having problems. Uh, but anyway, yeah, just going to be getting used to a little bit of the nuisances and things, little bothers, um, some which are just primarily aesthetic, like wearing this collar. It's comfortable, and if I'm out and walking around, I don't really notice it myself that much, but other people might. And um, anyway, I guess it's one of the uh, indications that you might not want to bump me because I'm going to fall pretty easy, and I think that's the medical world's main concern about me is if I fall, because I do have cerebral palsy, and I have had instances where many times where I've fallen, and it could happen anywhere, just balance, coordination. Hopefully, some of this will uh, lighten that up a little bit. That's what I'm hoping. I don't know if it's really going to happen, but it would make sense that freeing up more of the spinal column for brain signals to pass to the body would make sense. 90% of my problems were in this upper right quadrant of the body, with the arms and the shoulder and the hands all the way down to the fingertips. It got to a point before the surgery where I wasn't even able to feel the top of my fingertips, and my hands were completely numb, uh, very painful. Couldn't make a fist even. Uh, Radiating pain down my uh, right arm from my shoulder. That's radiculopathy, and actually, it's my general diagnosis is cervical myelopathy, which includes that and some other um, factors. And anyway, yeah, so no falling. I have titanium screws in here, about 4 inches worth in the front of my neck. And of course, that's very close to the trachea and esophagus. So that leads to kind of a worst continuing surgical symptom, which is, of course, swallowing is hard. Um, Something I knew would be the main uh, issue, at least at first. This may take 2, 3, 4 weeks to subside a little bit, but it's not uncomfortable. It's just, I can't like take a big New York steak or something that's 2 inches thick and swallow a piece whole. That would not be good. Most foods are, I'm still eating kind of chopped up, liquefied. Soup is good, but it doesn't sometimes give you the energy you need, I guess. Um, yeah, so also plenty of water too. That's another thing that they stress. Meds wise, I was sent home with, well, while I was in the hospital for those three days, I was taking pain medication, some pretty strong pain medication, um, uh, infection reducers, fever reducers, nothing that unusual. Some Pepsid for um, gas and that sort of thing, a stool softener. I did take some of the Dilaudid home with me and the Decadron, so just in case I have any kind of spasms, which I haven't had yet, but um, always need to be on the lookout for pain when you least expect it, or um, just I just need to be careful. Like I said a couple of times already, no falling, no grabbing or lifting up to any more than 5 pounds, and keeping the head as still as possible. That's why I can't drive, obviously, because I can't laterally move my neck. This prevents me from um, getting my neck too low. Everything benefits when things are still, and especially if I can maintain that for three to next 3 to 4 weeks until at least see the doctor again and get the brace removed and some of the other restrictions will fall off. I might be able to drive. Like I anticipate that. Not missing it right now though. Just my main goal right now for the next until I do go back for another evaluation is just to take it easy and to try to um, just have a just have a curing mentality, I guess. Really mindful to uh, not not be too active and rambunctious. Not trying to do too many things at once. I don't have a lot of help, like practically none, but I'm finding that already. I really don't need too much. I mean, nothing so far actually, and it's probably not that much different than how things were before. So uh, I will make it. As I'm almost certain this is gonna result in a successful um, uh, procedure. Things that I noticed right away, of course, were um, I can and much more arm movement. Although I don't want to do too much of that, I'm told at this point yet. Um, raising the arm up, I couldn't even do that above my head. Uh, what else? Just strength is not back yet. Strength is still feeling about as arm strength is still feeling, and shoulder strengths are still feeling about as weak as they were before. But that's because I haven't done anything since then. And I think I'm going to try to go back to work in 2 months too. I have a kind of a light part-time um, manual labor type thing. It's not a big deal. It's just I've been working at a supermarket for the last 5 years since I left my uh, primary professional experience, and for you know just just to be doing something productive, and I didn't know it was going to be 5 years, but it is. And so I want to get back to that eventually, uh, and just try to hang and enjoy the benefits of pain-free, as pain-free as possible, uh, flexibility in my areas where, though I haven't been able to feel that for a long time, just an overall freedom. And because there's a lot of life to live right now. And I'm glad I had it now rather than waiting until I'm in my 80s or something and trying to have this, which I'm not sure I would have been allowed to do anyway, but feeling pretty good overall. Um, and I guess I'll try to make another video maybe after the post-op with the doctor in 2 or 3 weeks or whenever it is, and that'll be a month, and then maybe something a little bit further out the line. For right now, um, things are going good, and just taking time to heal and recover. Have a great day. I um, hope this has been somewhat informative, and I know it's been long, but rambling. But if you do have questions for me, you can uh, certainly send them to me, or um, like this video if you do. So I will be talking to you soon. Thanks. Bye.